I've been practicing cardiology now for 26 years and a number of years of training before that, and we heard back then and we hear today that the #1 cause of death in Western countries is heart disease. In fact, it's been that way now for 50 years. And that's scary, and that's actually just a statistic, but that means a husband died, or a father died, or a wife died, or a parent died. I mean, it's real people, real names that I care about a lot, and the family cares about a lot. Dean Dupree and Imre Molnar and Blake Krikorian and others that I know that just died tragically. By now it was anticipated that with all the technology in heart disease, we're talking about stress tests and coronary care units and angioplasty and bypass, that it wouldn't be the case anymore, but we're still #1, heart disease is. And in fact, it's just been reported that in the last year or two it was expected that cancer would overcome heart disease as the #1 cause of death, and it hasn't happened. There's actually was a drop in heart disease deaths. It's plateaued now. And I'm concerned that it's plateaued because lifestyle messages have become confused. Butter, good or bad, dairy, good or bad, bacon, good or bad, and the public is so confused they do whatever the heck they want, and some of the progress that was being made with a more consistent messaging until the last 5 to 10 years. So yes, it's still #1, but heart disease is 80% preventable, 80% preventable. By not smoking, walking, sleeping, managing your weight, and eating a crap ton of fruit and vegetables a day. That's C-R-A-P-T-O-N, crap ton of fruit and vegetables a day. It's an important message that just isn't said enough. It's a boring message. It's not sexy like CrossFit and coconut oil, but it's the true message. So that's what my passion is to keep repeating that over and over until people leave or they get it. And that's what we're doing here today at the conference. What kind of control do you have over whether you get heart disease? And we know, and it's fascinating, there are cultures that have traditionally very low rates of heart disease. There are cultures with very high rates, 10 times the difference between Japan and Finland, at least, maybe 20 times the difference. Well, is that genetic? It isn't genetic, because you can take a Japanese person on a traditional Japanese diet, move them to Hawaii, they're still the same person, and that family's heart disease risk goes up significantly because their diet changed. You then move that family to California, and you see their risk of heart disease really go up. Their genetics didn't change. It's lifestyle, baby. And those studies were done 60 years ago. We realized the importance of your diet, your activity, your stress, your sleep. But if you embrace those lessons, some might call them blue zone lessons, the areas in the world where longevity is the greatest. Very different diets, different cultures, but there's common threads. Plant-strong diets, activity, social connections, absence of processed food, limited added sugars, enjoying alcohol in many of those communities. You can design a life that's got a very high chance of being heart attack free and heart disease free, the #1 killer in America. The side effects are you lower your risk of cancer, lower your risk of diabetes, obesity, dementia. Those are the side effects because they all go around a central lifestyle that is not the Western lifestyle of sitting around gorging Kentucky Fried Chicken watching football games. Yes, I'm a big advocate of test, not guess. So what does that mean? You're 50 years old, you're at your internist, you're 40 years old, you're at your internist, your family doctor. You get your blood pressure, your blood sugar, your blood cholesterol. Maybe you've had an uncle that had a heart attack. Maybe you're sitting around at your job, you've gained some weight, but you get a slap on the back, everything's okay, I'll see you next year, or whatever. Now, if you're 50, you're gonna have a colonoscopy, at least recommended. So you're gonna actually go inside the body to look for a polyp, test, not guess. If you're a woman, you're gonna have a mammogram or maybe a thermogram, but you're not gonna guess, you're gonna test for those conditions. Heart disease doesn't exist in the standard model. It's absolutely fraudulent because 2 tests were developed 15 to 20 years ago. One is a CAT scan of the heart. Some people don't like radiation, but fortunately technology has advanced that a coronary artery calcium CAT scan of the heart is about the same amount of radiation as a mammogram. No iodine dye, no injection. You just lie down, roll in a machine, roll out and go home, and you may have to pay $100 for the exam, maybe even $150. You will find out, test not guess, if you have silent heart disease. You won't be surprised 10 years later or 5 years later that you're having a heart attack, a stent, or bypass, you'll know the score. In fact, it's called the coronary artery calcium score. It's a number. Could be 0, could be 800, and you've got silently diseased arteries you had no clue about. There's also an ultrasound of the carotid called the CIMT, carotid intimal medial thickness ultrasound. Not as widely available, also usually not insurance covered, except the state of Texas. When you're 50 years old in Texas, you can get a free carotid ultrasound or a free calcium score, insurance covered in terms of free, because one legislator got that through their state government and it's a covered benefit. So test, not guess. Find out if you're walking around with the #1 killer in America with the same philosophy that a mammogram or a colonoscopy searches for disease by looking at the organ. Let's look at the organ, the arteries and the heart arteries, and find out where you're going. Then let's implement a plan, if there's disease, to stop and even reverse it. There are advanced tests. One of the most unappreciated parts of the body is that 50,000 miles of arteries in your body. 50,000 miles of artery. Think about your car hitting 50,000 miles. That's how many miles of arteries in your body. Every artery is lined with something like a wallpaper. It's one cell layer thin. So thin you can't see it. Under a microscope you can. That's called your endothelium, E-N-D-O-thelium, your inside skin. And that endothelium is a barrier between the blood in the vessel and the wall. But we learned over the last 30, 40 years, it's a very active, incredibly important organ. If you were to take all that out and lay it out, it'd fill 8 tennis courts. So it's this huge organ of activity. If your endothelium is healthy, you're very resistant to stroke and heart attack. How do you make your endothelium healthy? You don't smoke, you exercise, you lower the saturated fat or get it out of your diet. You eat rich, nutrient-rich fruits, vegetables, nuts, seeds, whole grains, and legumes. You manage your blood sugar by avoiding added sugars, added syrups. Well, there is a test called the EndoPat. It's a machine that's available in certain specialty heart clinics like the one I have in Detroit. And you can measure if your endothelium's working well. And if it isn't, we've got to institute a program. Certain foods, watermelon, beets, spinach, red spinach, or arugula can improve the health of your endothelium. So when you're eating in the plant-based world, you're eating an endothelial healthy diet. When you're eating at McDonald's, you are destroying your endothelium. They should say billions of endothelial cells damaged. Are you nuts? No nuts? So the history of nuts is, I'm a little nuts too, that there is this field of science that says you can create a diet that can reverse decades of heart artery problems with a change in diet. And when you go back to the 1940s and early 1950s, some of the pioneers in this field, Dr. Lester Morrison in Los Angeles, designed a diet based on some studies that he was reading that was very low in added fats, and he excluded nuts from his program. In the 1951, he documented he could cut heart deaths in half by a diet that was very low in added fats and had no nuts and seeds. So that got into the concept that this might work. There actually wasn't that much data that nuts and seeds were healthy at the time. But things moved forward, and Nathan Pritikin opened the Pritikin Longevity Center. He wanted to reduce the amount of fats in the diet to a low level, total fat, so nuts and seeds were left out. When Dr. Dean Ornish started studying heart disease with diet and has done some of the most unbelievably important studies on heart disease, cancer, and aging with plant-based diets, he wanted low total calories from fat with the idea that if you have a low blood cholesterol, you're going to have a very low risk of heart problems, and he proved that to be true. So he didn't add nuts and seeds, and the Cleveland Clinic had a program with Dr. Esselstyn. Well, along the way was other data points, like the Adventist Health Study in Loma Linda and other places, that actually showed nuts and seeds were very favorable in terms of longevity. And we found walnuts could be very healthy for your arteries when you study them with techniques like the EndoPat and your endothelium. So it became a bit confused, and I think now most of us have become a bit more liberal, that of all the possible transgressions that you could add to a plant-based diet, fruits, vegetables, legumes, whole grains, adding in a small amount of nuts and seeds every day is now okay. It's, in fact, may be favorable. You've probably got to give a nod to Dr. Joel Fuhrman and books like Eat to Live and such, The End of Heart Disease, his new book, that has kind of been pushing on that topic, because there is science that it is a very healthy, fiber-rich, nutrient-rich, polyphenol-rich, polyunsaturated, fat-rich, not saturated fat-rich food group. So yes to nuts and seeds, but we're not talking a whole bag of salty pistachios or honey roasted peanuts. We're talking, your oatmeal has a teaspoon or tablespoon of whole walnuts on top. Good choice. Yeah, so the question revolves around our diet in the Western world, and specifically the United States. And there's a story that goes like this. I'm going to answer the question the way I want to answer the question, which is certain scientists, led particularly by a PhD in Minnesota, Dr. Ansel Keys, identified that fat in the diet, and ultimately saturated fat in the diet, would raise your blood cholesterol. That's actually true. That's science. Before the food industry got involved and was mudding up researchers' interest, that was all the science showed. Saturated fat in the diet, things like butter, cheese, meat, and eggs raise your cholesterol. And when you have a high cholesterol, you develop heart disease more regularly. That's true too. So saturated fat in the diet creates heart attacks and heart deaths. That's the real science, although you'd be very confused nowadays. So the story went, Dr. Keys and his colleagues actually manipulated the government and manipulated the American Heart Association to sell this program to the American public that they should reduce the amount of saturated fat in their diet, which is still the strong recommendation of the American Heart Association. In fact, they've gotten even stricter in the last couple of years. 5 to 6% of your calories, saturated fat or less. It used to be 7% or more. Anyways, that the problem all along has been sugar. The whole problem was too much added sugar, and we missed the boat. And if we would have grabbed on in the 1970s to the public message, don't add added sugar, we would have solved all the health problems in America by this point. That's a common statement. Well, it turns out that there's so many false statements in that kind of body of propaganda. It would take me hours to go through. But what's really happened since 1970 is Americans eat 500 to 600 more calories a day, including more oils, fats, sugars, and protein. Every food group has increased. So they never listened to the government. If the government and the American Heart Association was saying reduce your added fats, reduce your saturated fats, the Americans said, I like fast food and I like convenience, I like vending machines, I like food trucks. They didn't do it. In fact, 500 to 600 calories more a day means you're going to get fatter and fatter and fatter. What's happened in America? We are doing whatever we want. We've got this abundance of processed food. 60% of our calories are processed food. We're adding calories every day. These are calorie-dense, nutritionally poor food choices. So yes, calories have gone up a lot and we're suffering from it. But it certainly wasn't the advice of health heroes and health researchers in the 50s, 60s, and 70s that that's what food industry should respond and fast food industry should respond. You know, we used to live for centuries with a scarcity of food. Now we have such an abundance. We suffer from lack of willpower and food rules, but it's not the fault of these researchers or the American Heart Association. Yeah, you would think if you had identical twins that they should be at equal risk of disease like heart disease. And if one had a heart attack at age 45, the other must have disease. And when they've studied identical twins, so their genetic code is essentially identical, there's actually a very different risk of a number of diseases, including heart disease, if they ended up living in different parts of the country with different jobs. So it was one of the points that proved environment tends to trump genetics. That's not always true. There are certain cancers, heart conditions, certainly congenital heart disease. If you're born with a serious abnormality, that's a genetic and developmental problem. That's not related to environment. But if you have identical twins and one follows an exercise, stress management, non-smoking, active lifestyle, rich in plant-based nutrition without chemicals and added fats to excess, and one takes the standard American diet, you're going to end up with two very different heart patients in terms of risk and actual disease. So again, the genetics load the gun, but the environment pulls the trigger. Control your environment, make good decisions. One of the greatest teachings there is that's relevant today is from the 1600s. There was an English physician, Thomas Sydenham. He was known as the English Hippocrates. He was so famous. He had a textbook that was used for 200 years throughout England to teach medicine. And he has a quote that a man is as old as his arteries. And we'd have to change that nowadays to a person is as old as their arteries. But I like to make it positive. You are also as young as your arteries. What does that all mean? We have the technology nowadays to know if you're 40 years old, are your arteries structure and function like a 40-year-old, a 30-year-old, or a 60-year-old? And if your arteries are aged because of lifestyle or genetics, smoking, dietary choices, sedentary lifestyle, if you're 40 years old, but we measure using various technologies that your arteries are 60 years old, it's not only increases your risk of heart attack, need for bypass and stents, it's a body-wide aging. That's what's really been some new research, that if your arteries are aging, you're at greater risk of kidney problems, dementia, premature death. It goes throughout the entire body, even lung disease. So how can you know the age of your arteries? One is a CAT scan of the heart called a coronary artery calcium scan. Calcified arteries are old arteries. You shouldn't have calcium in your arteries, maybe by the time you get 80 or 90 plus, but you still shouldn't have it. It just develops more readily. There are ways to put little devices on your finger. It's called pulse wave analysis. I do it routinely in my clinic. That can tell me if a 45-year-old has the arteries that are functioning like a 65-year-old or a 35-year-old. And there's an ultrasound of your carotids. Same thing. My patients are more motivated to change than almost anything I've seen when I show them a report that says that their 50-year-old carotid arteries are more akin to a 70-year-old, and they look at it aghast, and they are aging. It's accurate numbers, but it is a platform to develop a program and reverse it and improve it. One of the greatest fears, probably a fear greater if you were to ask the public, than dying of heart disease, having a heart attack. That's like a badge of honor. I have 5 stents and I'm doing fine at my McDonald's family reunion. But losing your memory, forgetting where your car was, losing your keys, forgetting phone numbers, and then more progressive problems with memory, some of which is what's called Alzheimer's dementia, some of which are little strokes, vascular dementia. But some of it is nutritional. B12 deficiency would be one. And some of it is drug related. Whenever I see a patient that is describing, or families describing the beginnings of memory loss, you got to look at the list of prescription medicines. You should look at the list of supplements too. They may be on too many supplements. It may not be enough. They may be deficient in B12, omega-3, vitamin D, and you need to add supplements to replace that. But the prescription drugs are really important. Thyroid function, is it adequate, and is it supplemented excessively or not enough? Beta blockers is a form of drug used for blood pressure and cholesterol. Cholesterol-lowering statin drugs, Zocor, Lipitor, in my practice have a limited role. They have a role. Giant review that just came out recently in Lancet strongly makes a case that many, many lives are saved by statins. Now, if we lived a healthy lifestyle, we wouldn't need a fraction of them, but they are a crutch because people aren't adopting a healthy lifestyle. But nonetheless, there clearly are people that their mental clarity improves when you give them a 6 to 8 week vacation from a statin, and then you just have to look for another way to manage their lipid disorder, their cholesterol disorder, hopefully by lifestyle, by changing their diet, lowering their saturated fat intake, going towards a vegan, all plant-based diet, but possibly other approaches, niacin, berberine. There's a number of supplements that lower cholesterol, turmeric. A common class of prescription drugs for heart disease are called beta blockers, B-E-T-A. Been used for 40 plus years. They can be used for chest pain called angina. They can be used for skip beats called palpitations. They can be used for blood pressure problems. There are side effects. People feel tired. People with asthma may have worsening asthma, may slightly raise cholesterol and blood sugar, may cause some sexual impairment, erectile dysfunction, not a fun thing. And again, the whole goal of lifestyle medicine is to try and manage life without disease, or if disease is present, try and reverse it. So in my experience, on a whole food, plant-based, vegan diet, blood pressure can come down dramatically. We've seen that over and over. Dr. Joel Furman just published some data that blood pressure may drop by 25 for systolic and 15 for diastolic on average and sustained by getting off of processed foods and getting on to a whole food, plant-based, nuts and seeds kind of diet, then you may not need your beta blocker. Similarly, when you're eating lots of fruits and veggies, nuts, seeds, whole grains, you're getting a lot of magnesium and potassium. So often the palpitations will go away. And then you don't need beta blockers for the palpitations in some cases. If you've had a heart attack, there's some data that for the first few months after a heart attack, being on a beta blocker is good. But people end up on them for 30 years and questioning, do I really need this? Is there data that I need this? And the data's come out now that after that first year after a heart attack, beta blockers don't really add anything. So always good to look at the medicine list and ask your doctor, ask yourself, do I really need this for the rest of my life? Don't stop medicine without discussing it with your healthcare provider, but challenge and question if you need a acid blocking medicine for the rest of your life. It never was designed to be used for your whole life. Bypass surgery was a great advance in treating the worst heart patients. 1969, the Cleveland Clinic, very commonly performed operation. Numbers knocked down a bit when we got balloon angioplasty in the late 70s and stents in the early 1990s, better stents in the early 2000s. But there's still a lot of bypass. So, bypass cures nothing in terms of the pathophysiology. You have a blocked artery, you just make a detour so the blood has a new way to get to the heart muscle. That's a great thing, but why did it get blocked in the first place? Diet, stress, lifestyle, smoking, poor nutrition. The surgery doesn't correct any of that. And it's very rare that a patient really gets the whole story, because if anybody needs lifestyle enema more than anybody, it's somebody who's had enough blockage. When I say lifestyle enema, I just mean really lifestyle redo. We should do a TV show called Lifestyle Redo for the heart patients and make it fast-paced like some of the fashion redos. It's the bypass patient needs that kind of approach. And they may get lucky to have their doctor refer them to a cardiac rehabilitation program where they'll exercise, and they may hear some things about the Mediterranean diet and processed food and eating well, but they probably won't. I'll give a shout out. There's two special kinds of cardiac rehabilitation programs. You've had bypass surgery, or maybe 6 weeks out you're recovering. There's one called the Ornish Intensive Cardiac Rehab Program, or NISH, and one called the Pritikin Intensive Cardiac Rehab Program. They're covered by insurance. They go much more in depth about reversing disease for the future, because people who have bypass, and who do we know probably most famous would be somebody like Bill Clinton, has his bypass surgery in 2004. 2007, he's back in an emergency room with chest pain. One of his bypasses had shut down. Very common that the bypasses last for a very short amount of time. It's a Band-Aid. And he needed a stent 3 years after his bypass to unclog an artery that used to be bypassed. And then he sort of got the religion. He finally found out that bypass is a very temporary Band-Aid if you don't learn how to change your diet. So it's reported that 20 of 21 meals a week that President Clinton eats are plant-based, low oil, like Dr. Ornish, Dr. Esselstyn would advise him. And 1 meal a week he may eat a piece of fish because somebody told him fish was necessary in his diet. But I give him pretty good grades for 20 of 21. Yeah, we not only put poor food choices, poor fuel into our body, but we now live in an environment where unfortunately it's challenging from externally. There's actually a word for this called the exposome, what we're exposed to. There's something called your genome. Now there's some in metabolome. Now there's something called your exposome. The analogy I would think is you've got a really great car, and you do put premium gas in this great car, like it says on the gas tank. You put really great food in your body. You put really whole food and nutritious, maybe organic foods. But you're driving down roads that are poorly paved and potholes. You still end up potentially with a broken, form of transportation, and our body is that form of transportation. So pollution has come on the scene. Sadly, it's come on the environment, but it's come on the scene in so many medical studies. 4 million people a year worldwide die of dirty air exposure. Most of that are poorer countries where they're cooking inside their house. and the house becomes nothing but a toxic brew of sooty air from cooking. So that's a third world problem that will slowly resolve with better technologies. We just got to get all those people at George Foreman Grill and an electrical outlet, and at least we'll take care of the smoke problem. That's a shout out to George. I don't have any interest in his product, but nonetheless, it's a great way to grow vegetables indoors. But we're also talking about literally what factories are doing, what cars are doing. You know, Beijing gets all the attention because the air quality is so horrible there. It's measured in parts per million, I think. And during the 2008 Olympics, they knew how bad the air quality was. They shut the factories off about 4 weeks before the Olympics, shut them back on a couple weeks after. During those 6 or 8 weeks, they actually measured major improvements in health by shutting down the factories and just slightly improving the quality of the air in Beijing. Actually, all kinds of parameters of respiratory disease and heart disease improved. And we're seeing that all over, that living closer to a highway, actually exercising close to a highway, all can increase your risk of heart attack, increase your risk of various heart arrhythmias. So it's very central in cardiology research. It's just not talked about much. And what do? You know, you want to open your house and get good breezes now and then. I have air filters in my house and office that are running all the time. You want to take your shoes off and not necessarily bring in every form of dirt and all, although that's a different form of just making your house air a little dirtier. You know, we don't want to live a completely sterile life. We like the fact that we have a diverse culture of bacteria in our body, but air quality is key, and be aware of that. I mean, big trucks go by, hold your breath if you can till you're somewhere where it's a little bit cleaner. And living in a dense urban center is not good for your health. You know, when we talk about the exposome, or things that you're exposed to that may affect your health, it's not just a truck going down the street while you're jogging and you have the gift of breathing in their diesel fumes. We've learned that there's many home products. There's a class of chemicals called phthalates. Nobody can spell them. If you know how to spell them, raise your hand right now, but it's P-H-T-H-A-L-A-T-E-S. I've been studying it. And phthalates have been used in perfumes, in air fresheners, in those plug-in air fresheners, in shampoos to give things fragrance and smells. Turns out they're amongst a class called EDCs, endocrine disrupting chemicals. Those chemicals get through your skin, get inhaled, they get inside your body. If we do urine tests, almost all of us will have demonstrable levels, even children, of endocrine disrupting chemicals, of which phthalates are a big class. And they affect your thyroid function, they affect your fertility, they affect perhaps other glandular functions. So one of the theories is that the rise in obesity is in part due to 500-600 calories a day more than we were eating 35 years ago. But it's also the fact that our endocrine system is being bombarded by this, and being aware and being careful about you know, perfumes and air fresheners and plastics and other things that are potentially rich in phthalates. So the good news is there are some major manufacturers or retailers, Target and Walmart, that have announced a list of like 500 chemicals that by some date, I think it's 2018, they will not be buying products from manufacturers that have these, and they will be moving out of the market because of market forces like that. That is one of the brightest spots I've heard. In fact, another one called triclosan, another endocrine disrupting chemical separate from phthalates, FDA just announced they have to be removed from hand soaps, antibacterial soaps, very quickly, because not only do they not work, they can disrupt your endocrine system. So another victory that a few years ago you'd say this is soft, kind of foo-foo, tree-hugging medicine, and now it's the FDA endorsing. Yeah, plastics are again a source of chemicals that might be called your exposome, things you're exposed to that we never really thought much. You go back to the movie The Graduate, I think that was in the late 60s, and when Dustin Hoffman's getting advice on his career, the older man says, you know, your future is plastics, plastics. I think his name was Ben in the movie, if I remember. Because that's when so much excitement about being able to replace ceramics and stainless and other things with plastics. And you know, now we fast forward 45, 46 years, and we have plastic bottles choking off the oceans, and creating huge landfills. But they're also harming our health directly, immediately, not just the terrible impact on the environment. So plastics are often rich in bisphenol A, BPA, and there's another one called bisphenol S, BPS, that is not as well known, but equally toxic or more toxic. And the concern, again, endocrine disrupting chemicals. If you take any family in the United States and check urine and measure bisphenol A, BPA, 90+% of Americans will have measurable and potentially high levels of these chemicals from drinking in plastic, coffee in plastic, taking your lunch to work in plastic, microwaving in plastic, and other sources, thermal receipts. Would you like the receipt for that cup of coffee? You grab it, you touch it, those have bisphenol A. It's recently been shown that if you're buying fast food and that burger's wrapped in that plastic wrap with Ronald McDonald or Wendy's logo on it, that's rich in these chemicals, and it gets in the food or on your hands, but more so in the food. So there's so many sources of these endocrine disrupting chemicals from plastics, and being aware of that, and not drinking in plastic cups, and not, there's cans, the lining of cans is very often BPA. And you can find some manufacturers that will label it BPA free. You wonder about that other one, BPS. That isn't commonly, I've never seen that labeled on a can, BPA and BPS free. It would be nice to know that. But that's why you might see soups now that are in more cardboard kind of containers as opposed to metal cans, because I think we're okay with that kind of packaging. But being aware of this environment, going to a site called Environmental Working Group, EWG.org, kind of not-for-profit, not tied to industry reviewer that might give you some good insight about products you can buy that are free of these chemicals. Yeah, your skin absorbs readily, so there's a statistic that if you put some kind of lotion on your skin, within 25 to 30 seconds, it's inside your body and in your bloodstream and throughout. So it turns out many antibacterial soaps, hand lotions, perfumes, hair products, lipsticks are placed on the skin and then they're inside the body. Well, there's a multitude of contaminants. Many products are being made overseas in China, and there's heavy metal contamination. You're putting on lipstick and there's lead and mercury, and then it's in your body, very toxic substances to the body. Same thing with lotions and all. So I urge people, there's again a website called EWG.org, Environmental Working Group, EWG.org. It's a great resource to see if the products you buy may be contaminated with some of these endocrine disrupting chemicals and alternatives. So I've changed my shaving cream, I've changed my deodorant, I've changed my toothpaste, I've changed my facial lotion, I've changed my hair gels and all, because I'm looking on the label where it says parabens free or BPA free or phthalate free. I like when it says not tested on animals for other reasons. But you got to be very careful because this rise in obesity, and with obesity comes blood sugar and cholesterol and blood pressure and heart disease and cancer and dementia risk. Some of that is the chemical environment that we live in. Dry cleaning is oddly and strangely and not very spoken of risk to your health. There's a book by a colleague of mine, Dr. Brian Clements, called Killer Clothes. It covers both flame retardants that may be in children's pajamas or bedding that can get inside the body and have toxic effects. But the way the dry cleaning is done in most places involves a chemical called PERC, P-E-R-C, and it's inundated through the fabric of whatever is dry cleaned. And it has a process called off-gassing, so that it's actually, you no longer have 100% organic cotton shirt. You have 100% organic cotton shirt loaded with a chemical called PERC. And it may take a few days for that to free itself from the material of the shirt or the dress or the jacket. So one alternative is to look for a cleaner, a green cleaner that indicates they use kind of organic solvents that are not riddled with these chemicals like PERC. And the other is to leave your dry cleaning actually in the garage or in some distant place. You really don't want it in your house. Take the plastic bag off and give it 2-3 days to off gas. It'll literally, you won't be able to see it, but some of these organic solvents that can be dangerous to your health and can documented cases of affecting children's health and rashes and appetite and nausea and headache problems, actually to let that material out of the dry cleaning before it affects you. And some people have to go to all organic cotton clothing and never dry clean to really overcome some of that health impact. The cell phones fall in this larger topic of electromagnetic radiation or electromagnetic frequencies. You know, we live in a Wi-Fi world and we can't see them, but there's all kinds of radiation exposures that are, you know, in every place we're at, work, hospital, even public enjoyment places where if you can connect to Wi-Fi, and in our houses, you know, 24/7, we're exposed to an electronic source we weren't exposed to before. And although it's still a developing field of science, there's actually been some data that there are some people that are genetically more sensitive to EMF, electromagnetic frequencies, than others. There are some people that feel poorly based on that. And cell phones are a strong source. If you were to actually read the small print that you sign or you agree to when you accept the operating system of your cell phone, there will be wording that says things like don't have it within a couple inches of your head, and don't have it near children, don't have it near pregnant mothers. Of course, we never actually read these pages and pages of small print that comes with the phone, but it's actually in there to protect the company. Although it's not proven science, it is of concern. So what are the options? I mean, people that are sensitive, or if you're just concerned, some people will shut the Wi-Fi off at night. You're probably not using your phone a lot at night. Turn it off at 8 o'clock, turn it back on at 7 in the morning. At least you give the whole family a break from Wi-Fi. Now, it doesn't always work so well with everything being Bluetooth now, and even home alarms and all, so it may not be an option, it's a thought. I try very hard not to have a cell phone by my brain. There's certainly a link of concern to brain cancer. Whether it's proven or not, we can argue back and forth. So whether, and I don't like everybody now in the gym having Bluetooth technology rather than earpieces and such, because you're putting EMF so close to the back of your brain and an area by your back of your ear that's sensitive to radiation. So I would encourage people to use the speaker, hold the phone a little further away, because the fall off of radiation is quite a lot. Even just a couple inches away from your head is a tremendous drop in the amount of exposure to your brain. I hope there's, technology improves. For example, I have an infrared sauna at home, and it's rated to be, essentially non-existent EMF exposure, which is a concern with some saunas. And I hope we get to cell phone technology. Maybe that's possible, maybe it's not, that will have that same built-in safety feature. This whole issue of electronic exposure to the human body and what it might be doing to our health, and smart meters have become a topic of concern rather than the old-fashioned meter checker that just had an analog system. Now they're digital, now they're a source of EMF, and there are some people who have tried to fight City Hall and resist the smart meter. Again, it kind of has put the meter reader out of business, but is it affecting our health? We have a real high-profile case of that in suburban Detroit that a friend of mine is fighting City Hall. It's been ugly. And then living near power lines, those big, tall power lines, has been a question in terms of some fertility issues and growth issues and all. And I think it's a real issue. Our bodies are electrical. Every heart cell, every heartbeat, 100,000 times a day, 6 times, yeah, a day. Billions and billions of times. I'm making sure it's not 100,000 times an hour. It's all electrical. Every brain cell, it's all electrical. Sodium, potassium, magnesium, channels opening and closing. And we're talking about resources that are that we're exposed to that can affect the electrical system of the bodies. And is that aging us? Is that promoting diseases, particularly cancer? So you can run, you can't hide from Wi-Fi. You can run, you can't hide from power lines. But you can make some decisions in terms of some protective measures, and not choosing to live under power lines if you have a choice, renting an apartment that's in another location. So a lot of things to improve your exposome, your environment. The big elephant in the room of a lot of visits I have with patients they have the information. They know they have a pattern of eating they should follow. They know they have a gym membership. They paid for it. They know that they shouldn't smoke. They know that they should get up and move more at work rather than sit. A lot of it is stress. In fact, some people estimate that 3/4 of all visits to the doctor, whether it's belly pain, back pain, headache, fatigue, rash, somehow stress is the root cause. Financial stress, kid stress, elderly parent stress, work stress, job stress, health issues and concerns, marital, and not sure if I said marital, stress. And when we're stressed, we may sleep poorly, we may grab a donut, not an apple, we may skip the gym, and just stress itself may raise the cortisol, may raise adrenaline, rise our blood pressure, rise our blood sugar, gain some weight, affect our normal adrenal cycle. So stress has to be recognized, and again, sort of like exposure to EMF, you're not going to hide from stress or hide from EMF, but you can learn management skills and reduction skills. I mean, realize at certain family gatherings and work gatherings, it's going to be stressful, and walking into that room, I teach something called 4-7-8 breathing. It's about a 75-second little tool of breathing in through your nose for 4 seconds, holding it for 7 seconds, breathing out through your mouth for 8 seconds. 4-7-8, doing that 4 times, takes about 75 seconds. When people are about to walk on the stage, give a talk, about to walk into their boss's office to have a review, about to talk to a spouse about some issue or children, 4-7-8 breathing is a simple tool. I like herbs for stress. There's an herb called theanine from green tea, or ashwagandha from a plant originally from India, and they can give people in a non-addictive, safe way a little better cortisol kind of response and a little better feeling of well-being. A good night's sleep is probably one of the best things for stress. You can't get 7 hours sleep if you're in bed for 5 hours, unless you're sleeping at the wheel. So placing a priority on stress is one of the best anti-aging stress management. Healthy diet for stress. Good GI health by eating fermented foods and whole foods and avoiding processed foods with rich in antibiotics, chemicals, hormones, and additives. So those are all the keys. So, manage stress, recognize stress, learn about how to deal with stress, and you can improve the quality of life and hopefully the quantity.